Thanks for joining us tonight. COVID-19 is spreading throughout South Carolina too fast for contact tracers to keep up. That's according to state epidemiologist Dr. Linda Bell.
7 News reporter Ann Maxwell explains the struggle now to contain the outbreak.
With so many COVID-19 cases in the state, it's gotten to the point where containing it isn't easy. An emergency room doctor tells me he and his colleagues are worried things could get worse with the 4th of July holiday coming up. At the beginning of the pandemic, COVID-19 left scarcity in its wake, with shortages of tests to toilet paper. And now there's a shortage of people to keep track of it as it spreads from person to person, as more than 1,000 new cases are reported daily.
And if we think about an average of 3 contacts per case, that leaves us with having to interview approximately 4,000 people every single day.
State epidemiologist Dr. Linda Bell says contact tracing is effective for containment with a relatively small number of cases, but when the virus is widespread, it doesn't work as well.
And this means that focusing on group settings becomes our priority for contact tracing. In institutions where people congregate, such as nursing homes or correctional facilities, certain businesses or other facilities, and the intent is to prevent local outbreaks within those facilities rather than containment around individual cases throughout the entire population.
DHEC tells 7 News the state currently has 500 contact tracers to reach out to people who have been exposed and to monitor and guide them after they self-isolate. They're planning to bring on about 600 more in the next 2 weeks. Dr. OSSMANN with PRISMA Health says there are too few tracers to zero in on the spread of the virus.
It's very difficult to narrow that down beyond just general municipalities, general areas of the state where there's significantly more spread.
He and others who work in the emergency room at Greenville Memorial are concerned that cases could spike after the 4th of July holiday. The wave of the virus we're riding now began rising after Memorial Day weekend.
Make no mistake, this is a really serious disease. People die from this disease. People get really sick from this disease.
So we must get these escalating numbers under much better control. And to do that, each of us must make an intentional effort.
Dr. OSSMANN says if you do have plans for the 4th of July, make sure to wear your mask and stay 6 feet apart. In Greenville, Ann Maxwell, 7 News.
This has been South Carolina's deadliest week in the outbreak so far.